In sub-Saharan Africa, less than 50% of the population has regular access to medication. Plus, the healthcare professionals are regularly faced with shortages of basic health products. This is why the Africa Resource Center, ARC, a Bill and Melinda Gates Foundation initiative, aims to sustain long-term health programs by putting in place sustainable tools to guarantee provision of most needed health products for continuity of care and well-being of the populations up to the last mile.
What we're doing today is really part of our building the pool of expertise in supply chain by working with a very renowned institution called IAM and making sure we can bring together public sector, private sector, and academia to start discussing about really supply chain across the continent. And that's why we're very proud of this partnership with my good friend Mustafa Gerassi, with whom we're going to be developing this kind of lecture series across the continent and making sure we build the pool of expertise in supply chain.
The much-needed reforms in the health product supply chain can only be undertaken with a significant number of skilled human resources, which is why ARC has joined forces with the African Institute of Management, IAM, through seminars dedicated to supply chain management, particularly in the field of health for health administrators, professionals, and students to improve the demographics of supply chain managers in French-speaking West Africa.
The supply chain management is a critical process that we have to master in Africa, and IAM is a global business school. We have to teach business, and we have also to help the companies to face challenges. So that's why we are very proud to be in partnership with ARC and to hold this kind of event, and we are working also with our partner in Michigan University to offer a new master in supply chain management. And we will start it next October.
Senegal, however, is ahead of other countries in the sub-region regarding supply chain management in the health sector.
Senegal is quite advanced in many ways. Senegal is known for its Jegasina, Yekasina programs, which have brought the contraceptives down to the last mile. So this is a big innovation, and it's a big model that other countries would like to replicate. But it's not without its challenges. We are still looking for how to make it sustainable and how to look at the costing mechanisms so that through purchases of medicines by institutions and individuals, that money can get plowed back into the system to sustain it.
The panel discussions provided an opportunity to build on the good practices undertaken in the countries of the sub-region, as in Togo, which is in the process of implementing its national strategy for supply chain in the health sector. These series of seminars were initiated thanks to the support of an international steering committee composed of key players, including UNFPA.
For me, what I'm walking away with is how important it is for us as practitioners, as advocates for the supply chain, to really work with academia to make sure that the students have good opportunities to interact and to learn, because they are the future. They are the ones who are going to be carrying this forward.
Partners from the William Davidson Institute of the University of Michigan were among the stakeholders at this event.
So it's a partnership to help develop a new supply chain program, a master's in supply chain. The program will be flexible, though, in that people who don't want a full master's wouldn't have to take the whole thing, but it will offer a world-class master's degree in supply chain. And it will take advantage of some of the new pedagogical techniques, really focusing on action-based learning, interactions with companies, and involving companies in the education.
The audience, composed of students and other professionals interested in the topic, through questions and contributions, participated in a very constructive debate. The long-term goal of the academic partnership initiated by ARC and its partners will be the creation of a center of excellence on supply chain for health products in Africa.